Hello, everyone. Thank you so much for joining us on this lovely Thursday for our sex, gender, and women's health meeting here at the University of Utah. I appreciate you taking your time out of your busy schedule to spend some time with us and learn about our research in these areas. If you're watching this at a later date, thank you for making time. Even after the conference is over, we're happy we can provide some insights into some of the work that we're doing that may be helpful to you, or maybe you want to get involved in some of the work we're doing. So, a little bit about me. My name is Deanna Kepka. I'm an associate professor in the College of Nursing. I'm an investigator at Huntsman Cancer Institute. I focus on cancer health equity research and the prevention of HPV related cancers in the Mountain West, in the US, and around the globe. So, I'm really excited to talk to you a little bit about some of the work that my team and I have been pursuing this year during the COVID-19 pandemic. So I would like to especially thank Sarah Mann and Kayla Christini for all of their efforts in launching this project and data analysis activities and even in slide help for today's presentation. So, you know what? When we look at young adults in the United States, we only see 40% in 2018 ever having received one or more doses of the HPV vaccine. Now, this is perplexing because the HPV vaccine has been around since 2006 for girls and since 2011 for boys. It's recommended to be delivered as part of the Adolescent immunization platform with Tdap and Menoptera. It can be given as young as 9. It's expected to be given by 12. If you receive the HPV vaccine at 13, it's actually considered late. But the vaccine can be given to young adults up through age 26. No questions asked. It's part of a recommended catch-up immunization schedule. And one of my passions for this work has been, let's improve HPV vaccination in the Mountain West. We are bottom of the barrel in the United States. We're less than the bottom quintile because you can see we've got quite a few color schemes here, and we are white as white. So we've got a lot of work to do, even across the United States. As of 2019, only 54% of adolescents by age 17 are up to date with the HPV vaccine immunization series. And by up to date, that means that they received either 2 or 3 doses. It's a multi-dose series. Depending on your age, under age 15, you only need 2 doses. But in the Mountain West, we're even seeing much, much lower rates where we've got far less than half of our kids completing the HPV vaccine series on time, which means that by the time you're 18 in the Mountain West, there's a good chance that you haven't been vaccinated. And at age 18, you're in a position to make that decision for yourself. So we've been working on looking at HPV vaccination efforts that target young adults in the Mountain West. We have focused specifically on rural challenges because across the United States, as I told you, I focus on cancer health equity research. We're seeing up to 10% lower percentage point performance in HPV vaccination rates among communities that are rural settings. So if you're a rural young adult, you're much less likely to have completed the HPV vaccine series by the time you're 18 than if you're urban. And we know in our 5-state Mountain West region, we are largely rural. How are we doing in COVID vaccination? So given everything that we've been through over the last year, I've decided to look at, does some of these challenges in HPV also relate to COVID vaccine hesitancy? And once again, we are performing quite poorly compared to the rest of the country. This is a map that was just put out literally 2 days ago by CNN. We're seeing the entire Mountain West region, except for Colorado and New Mexico, having less than 44% of our adults being partially vaccinated. So that's not even necessarily completing the multi-dose series if you require the second dose for the type of vaccine that you got. So once again, we're performing poorly, and we've got a lot of work to do. And I am sure that these figures trickle down to the young adult population with even some lower vaccination rates. Because as you know, with COVID vaccination, often it's our older populations that have been targeted as the priority first. So what are some of the factors that relate to vaccine hesitancy. I'm sure not a day goes by that you haven't heard something about vaccine hesitancy on the news, or in a discussion with a friend, social media. So the three C's are the three domains of constructs that have related to vaccine hesitancy in the past, and that's confidence in the vaccine, so it's trust. Complacency. Do you think you're at risk for COVID or HPV? If you don't really think you're that at risk, you might be complacent and not make it a very important priority. Convenience. Is it easy to get to? Is it easy to complete the series? And this is a greater challenge for rural residents where they have to travel further for healthcare. But some new domains of care factors relating to hesitancy include collective response. Like, what's, you know, maybe I don't think I would necessarily be hospitalized from COVID, but no, I don't want anyone in my family, any persons that are around me to be impacted by COVID. So because by protecting myself, I protect them. Calculation. So, is your level of engagement in information gathering? Like how much are you interacting with news and other information sources related to perceived priority for this vaccine, or factors related to hesitancy? So we conducted a survey originally for this study. We were funded by the National Cancer Institute as a supplement award from our Cancer Center support grant to look at rural cancer prevention and control initiatives in the Mountain West with a focus on HPV vaccination. Originally, we were going to do focus groups, but pandemic hit, so we pivoted and moved to an online survey platform. So we conducted a survey from October to April, and we only included participants who are ages 18 to 26. So these are participants who are eligible to make a decision for themselves about receiving HPV vaccine or COVID vaccine. So I definitely would like to thank Sarah Mann for her wonderful time spent on putting these lovely slides together. So here's our distribution by ages. So you see we have a lot of 18-year-olds, a lot of under 22-year-olds. We targeted many college campuses in the Mountain West, mostly female, but we still have a good chunk of male. We had 2,600 participants in the results I'm going to present today. We had responses, so we targeted the entire Western US, including Alaska. And I love this color-coded map where you can see, yes, most of our participants, 38% came from Utah, and that's because of our network of listservs here, and it's pretty easy to access Utah respondents, but we still branched out and got respondents from all over the Mountain West region, including California, New Mexico, Alaska, Idaho, Wyoming. We really had a nice sample here. We also got a good mix of urban and rural. So the light blue is urban, the darker blue is rural by state. And then some folks lived in regions that could be considered rural or urban. And these rurality determinations were made by looking at participant zip codes and then mapping them to RUC codes, rural urban classification codes. And I greatly appreciate Kayla Christini's, my staff member, her efforts on this rurality classification. So we had mostly white respondents, pretty typical of our region, but we still had a good 20%, 19% of Hispanic respondents. So we're proud of that, and a mix of other races and ethnicities. So let's dig into a little bit of attitudes and knowledge. So how do people think about, are vaccines a good way to protect yourself from a disease? And you see, yes, this enthusiastic yes, you see a disparity between urban young adults really thinking, yes, it can protect you from disease, and then fewer. So we're dropping from 95% urban young adults thinking that to a little bit more than 75% rural young adults thinking that. And this was statistically significant. In general, do you think vaccines are safe? We're seeing a similar pattern where more likely urban respondents think vaccines are safe. And keep in mind, these are only young adult participants. And do you think vaccines are effective? And again, urban participants are more likely to agree that they are effective. When we look at these other categories, I do not need vaccines for diseases that are not common anymore. So even, tetanus is not a very common disease, but it's lethal. So you look at differences in needing, um, perceived needing these different vaccines, whether or not the diseases are common. And you get a little bit of a disparity between what rural residents think, the dark blue, and what urban residents think, the light blue. So urban residents are more likely to disagree with this statement than rural. Are vaccines a good way to protect yourself from disease? And again, we see more likely urban residents agreeing with this statement than rural. And again, this is only among young adults in those Mountain West states. Are vaccines safe and effective? Well, again, we see urban more likely to agree that they're safe and effective. Is the HPV vaccine being pushed to make money for drug companies? And here you see disagreeing, we see rural residents are less likely to disagree than urban residents. And you can see a slight variation here where urban residents are more likely to agree or strongly agree than these other groups. So these are demonstrating higher levels of vaccine hesitancy among rural young adults versus urban in the Mountain West. So when we look at, do you trust these following persons regarding vaccination or medical information? So these are overall categories. We're looking at who matters when it comes to getting your recommendation and trusting that source. We see, 71% of our respondents trust their physician. 51 absolutely trust their provider, and 37% somewhat trust their provider. Health authorities, a slight dip, 62% yes, absolutely. Family and friends, we have more mixed reviews around family and friends. We have about 48% saying yes, somewhat. Government, we've got 8% saying absolutely not versus 47% saying somewhat they trust government. So what, again, like I predicted, we've got quite a few young adults in this sample, 47%, who've not had any shots. That means not a single dose of HPV vaccination, even though it has been around for more than 15 years for girls. We see disparities in girls, women more likely to have received the HPV vaccine than males in the Mountain West, and urban slightly more likely than rural young adults in the Mountain West to have received the HPV vaccine from this sample. So what are the main reasons you decided to get HPV vaccine? So we look at, some of the most important reasons are to protect your future partner or spouse's health, or your doctor recommend that you get the HPV vaccine. And we know doctor recommendation is one of the most important factors. And once again, you see disparities where differences between rural and urban in prioritizing HPV vaccination strategies. What are the main reasons you did not get it? My doctor did not recommend it. Well, here we see 36% of rural respondents saying their doctor didn't recommend it versus 27% of urban. So here's again, we see some disparities in why people did not get the HPV vaccine based on where they live. How about COVID? Have you delayed any vaccine because of the COVID-19 pandemic? And again, this is a little different. We see urban folks more likely to have delayed immunizations than rural. Has your doctor postponed HPV vaccination because of the pandemic? And again, we slightly see more urban healthcare teams postponing vaccination appointments than rural. Do you intend to get vaccinated against COVID when it becomes approved? So keep in mind that some of the participants in the study took the survey before the COVID vaccine was approved. And once again, we see more respondents in urban settings willing to be vaccinated against COVID than urban. And this is a huge difference. 71% versus about 49%. So I'm just going to touch on, I am the director of the Intermountain West HPV Vaccination Coalition. If you want to join our coalition, please email me after this, after you watch these slides. And you are welcome to participate in our monthly webinars where we bring the latest and the greatest HPV vaccination research to you. We focus on researchers in the Mountain West. We also focus on HPV cancer survivor stories and the perspective of healthcare teams trying to improve HPV vaccination in Mountain West settings. You don't have to join every meeting. You can join when you're able. We'd love to have you as part of our group. This is the region our coalition targets. It's quite expansive. We have tripled in membership over the last 6 years. And we're also we're recruiting right now clinicians in rural settings in the state of Utah to participate in a healthcare team intervention to improve HPV vaccination. And we were recently funded by Huntsman Cancer Institute and Intermountain West Healthcare Huntsman Cancer Institute and Intermountain Healthcare to do this. I'm so used to saying Intermountain West. Please contact me if you are part of a healthcare team in these regions of Utah and are interested in learning more. Thank you so much. This is my son who got his HPV vaccine last summer. I was so proud of him. Age 11, he was super tough because he got all 3 of those vaccines that I told you were recommended for this age group. Here's my contact information. Please contact me if you want to join our coalition or learn more or are interested in some research activities that we are working on. Thank you so much, everyone. Have a wonderful day.